What we're talking about is really taking a granular deep dive at all parts of the process, and you see this in industries, in manufacturing, in business, supply chains, where you're trying to figure out what are the weak points or the pain points, where are the delays happening, where could things become more efficient. You would think that all surgeons would want to make their surgery the best it can be to give the patient the best outcomes they can. And I don't think the majority of surgeons are slackers or lazy or don't care about any of that stuff. But it really takes a degree of passion to care about those small details like lighting or the kind of drape you're using or the temperature in the room or whether or not the patient has a blanket on them or whether or not someone's holding their hand during surgery because to alleviate anxiety. Where did you learn to have that eye for such fine detail? Is that something that just developed over time in private practice? Was it instilled in you from your dad or through training?
Yeah, good point. I think, I look back, a lot of it was instilled through my father. He had a passion. He gave this annual talk called Service America. And basically, realizing that medicine was, very much in the service industry and always trying to sort of provide better customer service. And this was back in the day when medicine was sort of, was it an expectation or sort of just a duty, or is it truly customer service? And, that's when they transcended sort of inpatient cataract surgery to outpatient cataract surgery to finally ASC cataract surgery. So there's a lot of innovation cycle that was going on through that. And he realized, customer service was going to be a key portion of that. So I remember, growing up, I actually had gotten in trouble a couple of times. I was maybe not the best kid in teenage life. I remember I snuck out, got caught like sneaking out to go to parties or whatever it was, and got grounded once. And then I did it again like 2 weeks later. And my dad sat me down. He's like, okay, it seems like grounding didn't work. He's like, here's a project. He's like, I want you to read these 4 books. And there were basically, now I look back on it, there are 4 books on customer service. And he was doing a talk at an upcoming meeting about customer service. He said, okay, I want a book report on these 4 books and explain what's going on. And they still resonate today. Some of the examples that they talk about where one, let's say, happy patient tells 4 patients about their experience. One unhappy patient tells 10 patients. So more or less, the math is going to say you got to eliminate all unhappy patients and then try to, encourage happy patients. And then now we look at the sort of the math is sort of compounded. If you look at what the internet does to that, one unhappy patient can not only, it used to be 10 patients, now they can literally tell 1 million patients with one post that goes viral about their negative experience. So the stakes are so much higher, but having that early sort of passion for customer service, a lot of it instilled from my father from being sort of a, rambunctious kid and, getting in a bit of trouble. So he kind of instilled that, and all those lessons sort of still resonate, but the stakes are even higher now.